Good morning. Time once again for Your Life Matters with clinical social worker Dr. Beth Plachetka from Safe Harbor Counseling and Dr. Beth Speaks. Dr. Beth is with us in studio once again. Doctor, how are we doing today?
It's always good to be here, Mike. How are you?
We're doing all right. We want to kind of wrap up a topic we started last week, focusing on medication and how that can play a role in trying to help with whatever issues you might be dealing with and the different ways to handle medication. And we're kind of keeping in that same theme today.
We are. And last week we talked a little bit about, how the medication can be like a cast for your bone. It can be for your brain, support your brain chemistry while you make changes, while you heal. And sometimes you need it permanently. And that's really, I'm going to say, up to those medical doctors that, as I say again this week, I am not. And I say to every client when we talk about this, I'm telling you what I know and referring you to the people who know best. So when we think about who prescribes to these 40 million Americans, any physician, any medical doctor can do it. So you can, you see, obstetricians and gynecologists doing it for women who like a postpartum depression, or internists doing it for clients or for patients in certain circumstances. But, the guru of psychiatric medication is obviously a psychiatrist. And so what we know is that you start with your medical doctor, you start with the person that you have a relationship with who knows you well, and say, this is going on, what can I do? And follow their advice. And then obviously if your doctor says, hey, okay, it's time for you to go further because this is the next step. Mm-hmm. Don't think you're crazy. That doesn't mean anything. It just means that they want to make sure that they're not missing something or that there's not interaction that they're not seeing. Another set of eyes is always good. Other people can also prescribe. Physician's assistants can prescribe certain kinds of drugs. Nurse practitioners can prescribe, especially if they're psychiatric nurses, right. They can do it. And in some places, psychologists, licensed clinical psychologists who have taken advanced training in it can also do it in the state of Illinois. So, but when you come to the office, I'm interested in, okay, if you're on medication, tell me why, and what made you go, and what is your doctor saying? Right. It's not that I'm going to change anything. I'm going to be paying attention to when you say certain things that might be symptoms of anxiety. We can check. Have you talked to your doctor lately? If there's a pattern of it, have you talked to your doctor lately about this particular symptom? Are there other things that could be done? Sure. I also really like to remind clients that an expert is your pharmacist. If you want to know about drug interactions, the pharmacy where you get all your drugs, your pharmacist is paying attention. And you can always say, just talk to me about this for a minute, pharmacist, and tell me, how are these things going together and how would they help me? Because I believe knowledge is power. I do think, you want to speak up to your prescriber, no matter who it is, and say, hey, this is going on. Call them, leave a message. If they don't call back, because our poor medical staff is really working hard right now. Yeah. There's a lot of people, not just prescribing, but there's a lot of people with getting care. You have the right to keep asking for the help that you need. Let them know about your changes. If you need a refill, don't wait, because sometimes that has to come from another place. You call them 10 days in advance and say, hey, I'll be running out on the 1st.
Yeah, they might not have them all on hand at that time. Yeah,
exactly. And then I always pay attention to the symptoms that they talk about. And if something starts creeping up, then let's talk again about what else we can do. So, I think it's important to have whoever your therapist is, that they know about your medication, but also understand that they're not going to make a recommendation about what medication you take.
All right. Very good information both of these weeks. You can listen to this show, past shows as well, at safeharboril.com. Go there for more resources on these topics. You can call Safe Harbor Counseling for therapy and support for individuals, couples, and families at 630-466-8657, or send Beth an email, Beth Plachetka, Plachetka, at LCSW at safeharboril.com. We'll see you again at the same time next week.